welcome everybody to our town hall tonight on the future of health care for West Virginians. Our meeting tonight is specifically about how the changes that have been proposed for the ACA, for Obamacare, will affect us as West Virginians. And we're going to begin by having a series of questions for the empty microphones. We did invite all of our reps here tonight. We invited Senator Manchin and Senator Capito and Representative McKinley. Now, Senator Manchin, I will tell you, is meeting with constituents in a town hall meeting tonight down in South Charleston. So yay for him. We're glad to do it. Senator McKinley had a scheduling conflict, and Senator Capito never responded to our request or invitations. So we're not sure where she is and why she won't meet with us to hear our questions about health care. But since she won't, we are very happy to take questions from members of the audience regarding health care.
The director of the 911 service in Wood County recently stated that Wood County leads the state in overdoses and in West Virginia leads the nation. That means we're #1 in the nation for overdoses. That's a very sad thing. ACA is a critical component of solving our heroin crisis. ACA, the one we have, has provided mental illness and substance abuse parity, which meant the end of substance abuse and mental illness treatment discrimination that had been in the past. It also provided for those states that expanded Medicaid for the poor and the working poor treatment for mental illness and substance abuse. We are a poor state. We need the ACA to continue providing us the mental illness treatment. But the Republican care bill eliminates that. So my question to Senator Capito, if she was here, would be, what are you going to do to ensure that we keep our substance abuse and mental illness treatment to solve our heroin crisis?
As the Republican care health plan has now come out of committee, the budget committee, and without scoring, I want to know, how can you guarantee that ending the individual mandate and replacing it with a 30% surcharge when somebody decides that they're sick enough to need the insurance, that it will be actuarially feasible to keep costs down? And to follow that on, as employers who employ 50 people or less are now allowed under Republican care to drop their insurance plans for their employees, how will insurers keep costs low enough for the people when there's less people in the insurance pool?
I'm Helen Killinger, and I live about 12 miles south here, Rockport, West Virginia. As a follow-up question, I would like to tell you a little bit of a story about myself. As a follow-up to what the opioid epidemic problem, I lost my son a number of years ago to the opioid epidemic. He died of a heroin overdose. Then my daughter, who was then in college, 22 years old, completely fell apart, quit college, and had to have a lot of care. Fortunately for the ACA, she was covered until she was 26, and then she was covered in Ohio's Medicaid and was able to become a citizen now, who is quite helpful. She's a medical assistant. But without the ACA, she could never have gone through this. She would not have been able to afford the health care. So I would like to ask Senator Capito, Representative McKinley, and Senator Manchin how the new Republican plan would have helped someone through a crisis like my daughter went through, were we to adopt that plan. Thank you.
And my concern is I have an elderly parent and have a mom who was in a nursing home for over 5 years. Republican Care is proposing dramatic cuts in Medicaid. According to AARP, 65% of nursing home residents are supported primarily by Medicaid. What happens to all of the indigent seniors who are in nursing homes and are currently covered by Medicaid?
Jenny Lee. I live on the south side of Parkersburg. And at age 61, I was able to get health insurance for the first time in my adult life because of the ACA. 10 years ago, my doctor said, Jenny, my goal is to help you make it through with that knee of yours until you can get Medicare. I turned 64 Tuesday. Right now, I have a silver plan, and I pay $152 a month. My income is $25,000 a year. If I didn't have the subsidy, my premium would cost me $800 a month. That's 38% of my income. If the premium remains the same, which it won't, and if I receive $3,000 a year help from the government toward my premium, I'll still be paying $550 a month, and that will be 26% of my income. I would like to know how I can possibly do that.
My name is Susan Shard, and I'm a resident of Parkersburg, West Virginia. And my question is, we all know that the cost of pharmaceuticals in the United States is exorbitant compared with Canada and other countries abroad. And would the representatives be in favor of an investigation into why that is and looking into the profits of the pharmaceutical companies? Because that would certainly bring down healthcare costs for everyone.
Another question to follow that up. The Republican Care talking point has been choice, choice, choice. You're going to be given your choice. Well, I have a question how that's going to happen in the insurance market. Paul Ryan was wonderful. He did a PowerPoint presentation and he said, all these young, healthy people are going to support all us older, sick people. Well, you know what? In West Virginia, we're old, we're sick, we're poor, and we live with a rural state with only 1.8 million people. Well, if you understand how insurance works, it is exactly how Paul Ryan said. They need enough people that are healthy to pay for us. Now, in West Virginia, the pie is too small to break it up with competition. That's why we don't have that many insurance companies here. So my question is to Senator Manchin, how is this going to work? What are you going to do? There's not much incentive for the free market in West Virginia for choice. So how is this going to work on the Republican Care Plan?
My name is Julie Slyer. Prior to 2013, I was incredibly healthy. I was very active. My husband and I were, for most of our marriage, in that tax bracket that got hit really hard with taxes. When I sold my business, I got hit very hard with taxes. I was that person who went once a year to the doctor. Every test was perfect. I was that person who saw drug ads on television and said I would never take that. I slipped on a rug and broke my back. I had surgery to repair my vertebrae, physical therapy, but my pain level was increasing. After many months, when complaining really paid off and a very smart doctor, he decided to do some genetic testing. I tested positive for a gene, HLA-B27, a genetic marker for ankylosing spondylitis. They performed an MRI on my lower back and saw fusing. Combination of having the gene and fusing equals ankylosing spondylitis. Was referred to a rheumatologist in Morgantown after waiting 6 months to get in, having a long list of questions. He immediately told me I could not have that disease because I was a female. He ordered an x-ray tech to put a foam block under my SI joint to see if it would open and get an x-ray. She asked if my joints were surgically fused, told her about the disease. Make a long story short, the doctor called me back and said I was the first female he'd ever seen with AS. I was put on a biologic called Enbrel. It worked for 6 months and then it stopped. I then went to see another rheumatologist. He told me I had advanced ankylosing spondylitis with emphasis in fibromyalgia. Put me on Remicade, a biologic that was an infusion. That lasted for 2 years. I was then placed on Cosentyx, which has not worked. I am now waiting to see a specialist at the Cleveland Clinic. To make a long story short, I have a very rare genetic disease that's hard to treat. Without health care, my biologic would cost $8,000 a month. With health care, I can participate in a drug support program that will pay whatever the insurance does not. Without health care, my body will fuse more in a forward position. My rib cage will keep fusing until my lungs collapse. In a recent visit, my doctor told me the curvature is getting worse. My rib cage is now narrowing, putting pressure on my intestines. I've had the ACA since January 1st, 2014. We pay our premiums, we always have, for Blue Cross Blue Shield. Without it, I'm not sure I would be alive. My husband and I would be bankrupt. My question is, with Republican care, since I'm a woman in my 60s, will my premiums go up 5 times or more? Will I be put in a high-risk pool? Will I have to choose between food or drugs? Is it my fault the pharmaceutical companies charge such outrageous amounts?
My name's Gary Thompson. I live in Wood County. Healthcare, affordable health care, is a part of what we refer to as the social safety net. This is a group of programs that really began during the Depression era under Franklin Roosevelt. They consist of programs like Social Security, Medicare, Medicaid, health insurance, unemployment insurance. These are all programs that are part of the social safety net. Other people call them entitlements. My question is for Representative McKinley and Senator Capito, and what I would like to know is, given Republicans' long history of an agenda of trying to cut, or eliminate these social safety net programs, and our president's demonstrated disdain for disabled people, do one or both of you intend to introduce legislation to repeal and replace the Americans with Disability Act after you're finished with health care?
My name is George Spranzy. I'm a resident of Vienna, West Virginia. I would like to ask all 3 of our senators and representatives if they would be using the language that is currently being used regarding health care, if they would be willing to repeal their own privileged health care and subscribe to the proposed Republican care.
My name is Megan Reynolds. I'm a resident of Parkersburg, West Virginia, here in Wood County. And my question for Senator Capito and Representative McKinley is, how am I expected to be able to financially care for my children with pre-existing conditions? I have a teenage son with a pineal cyst that requires an annual MRI to make sure that it's not growing, that it's not going to harm his brain. I have a toddler with a host of problems. He has developmental delays, sensory processing disorder, possible seizure disorder, and hypotonia. We have 3 different kinds of therapies that we do weekly. We have specialist appointments all over the nation. We go there and we do it because we have to. And the co-pays are enough to break us. We had a $60,000 hospitalization, of which we paid $4,000 thanks to the ACA. With a pre-existing condition, how is that going to be covered? How are we going to stay afloat? And how am I going to continue to be able to raise my children in this financial climate?
You've shared, you posed some interesting and very important questions, and you've shared stories from your heart that really touch people. And I wish that our senators, Senator Manchin, Senator Capito, and our representative, Congressman McKinley, would take this to heart and understand West Virginians aren't numbers. We aren't lines on a budget to be cut. We are real human beings with needs, and health care is a right that we all deserve. If you destroy the health care plan that we have now, you destroy our state. You push us deeper into poverty, and you push people into earlier deaths and bankruptcy. It's not a question of finances alone. It's a moral issue, and they need to take note and know that we're not going to put up with them cutting everything.